Welcome to the TargetBP, the importance of measuring blood pressure accurately training. The information from this training today is brought to you by the American Heart Association and the American Medical Association. My name is Jessica Newmeyer, and I'm a community impact consultant with the American Heart Association. And I'll be presenting today with my colleague, Chelsea Walsack-Burks, Community Impact Director with the AHA. We're excited to be here with you today to talk about the M in the TargetBP MAP framework, which stands for the importance of measuring blood pressure accurately. There are three critical components that you'll see here on the screen to achieving strengthened hypertension control within your patient population. The first one being measuring blood pressure accurately, the second one being acting rapidly, and the third one being partnering with patients. Measuring accurately is the foundation of this framework and will be the topic of this training today.
The objectives of the training today are to describe accurate blood pressure measurement, as it is the foundation for accurate diagnosis and management of hypertension, to describe the downstream effects that unreliable blood pressure measurements can have, list factors that can lead to inaccurate blood pressure readings and ways to overcome them, and use the Measure Accurately tools to improve blood pressure reading accuracy in your practice.
So let's take a moment for a pop quiz question. What percentage of adults in the US population have hypertension?
Would it surprise you that nearly half of the US adult population, about 103 million people, have high blood pressure? And of those with high blood pressure, almost half, 45.9%, are not controlled. That means almost a quarter of the US adult population is walking around with uncontrolled high blood pressure. Research shows that high blood pressure is a contributing factor to many major health conditions and is commonly known as the silent killer. The consequences of high blood pressure include vision loss, heart attack and heart failure, stroke, kidney disease and kidney failure, sexual dysfunction. In addition, high blood pressure can have additive negative effects when combined with other chronic disease conditions like diabetes and high cholesterol.
And the American Heart Association and the American Medical Association, we have found across the nation that it's actually quite common for blood pressure readings in the office to be measured inaccurately. So per the American Medical Association Blood Pressure Check Challenge, where they tested 159 medical students on the 11 elements of blood pressure measurement, only one student at that time was able to demonstrate proficiency on all 11 skills. The recommendations that came out of this challenge were that the measuring blood pressure correctly or accurately refresher training should be taught and reinforced throughout medical school, residency, and the entire career of clinicians. And the reason for this is inaccurately performed blood pressure measurements, which again are very common, can result in inaccurate blood pressure readings, which can contribute to uncertainty and potential harm to patients over time. Uncertainty or lack of confidence in the blood pressure reading is the leading reason clinicians fail to initiate and escalate therapy to patients with uncontrolled high blood pressure. And we know that this can lead to potential harmful consequences for patients. It is most common to measure falsely high, which may lead to overtreating hypertension, putting the patient potentially at risk for being harmed by too low of blood pressure. And in 2017, the blood pressure guidelines were updated per the American Heart Association and the American College of Cardiology. These are the latest categories for blood pressure measurement. 2017 hypertension guidelines, again developed by the American College of Cardiology and the American Heart Association, states that accurate blood pressure measurement is necessary to accurately diagnose and treat blood pressure. And we know that where blood pressure measurement is taken can have an impact on blood pressure measurement. So let's review the impact that the clinical setting may have on blood pressure. So for example, when the out-of-office blood pressure is high and the in-office blood pressure reading is high, then that can indicate uncontrolled or resistant high blood pressure. When the out-of-office blood pressure is high and the office blood pressure is normal, then that can indicate masked hypertension. When the out-of-office blood pressure is normal, but the in-office blood pressure is high, then that can be indicative of white coat hypertension, where a person's blood pressure is elevated or higher when in the office, when an in-office blood pressure measurement is performed. When both out-of-office blood pressure readings and in-office blood pressure readings are normal, then this can be indicative of normal or controlled blood pressure. So knowing that the clinical setting can impact the diagnosis of blood pressure, let's discuss the different methods that can be used to getting the most accurate blood pressure readings.
Next, we are going to review methods of blood pressure measurement and how the different methods address white coat hypertension and masked hypertension. So we are going to cover 4 methods of blood pressure measurement, including 24-hour ambulatory blood pressure monitoring, self-measured blood pressure, automated office blood pressure monitoring, and conventional blood pressure monitoring. 24-hour ambulatory blood pressure monitoring is the most accurate way to measure a patient's blood pressure and is considered the gold standard of blood pressure measurement. The patient wears a small monitor for 24 hours with a cuff on their arm, and blood pressures are taken every 15 to 20 minutes, and it can be set to every 30 minutes during sleep to minimize disruption. This method enables the clinician to rule out white coat hypertension, and it's the measurement taken outside the clinical setting. This method also enables the clinician to identify those with masked hypertension. Those with masked hypertension will show elevated readings outside of the office as compared to lower in-office readings. The cons are that the device is expensive, inconvenient, and you will likely need a referral to specialists to get it approved, and training is required to interpret. In the 2017 ACC and AHA blood pressure guidelines, self-measured blood pressure, or commonly referred to as home blood pressure monitoring, is recommended when 24-hour ambulatory blood pressure measurement is not available. This is the second most accurate method of blood pressure measurement, and this method can be used to confirm a diagnosis of hypertension, can rule out white coat hypertension, and identify patients with masked hypertension. Though in the cons, it does require the patient to have a home blood pressure monitor, and that does require the patient to also be trained by a healthcare professional and have follow-up with the clinic. And we're going to take a quick pause here and do a little bit of a pop quiz. Think about this. What barriers exist when implementing self-monitoring blood pressure programs? We'll go ahead and give you some of the most popular answers that we hear, of course, being staffing and staff time, the need for blood pressure devices, patient compliance, engagement, and loss of follow-up to share information. And then, of course, competing priorities in the clinic. And while these are all challenges, there are definitely ways to overcome each of these. Now, Jessica's going to continue on with our next method of blood pressure measurement.
Automated office blood pressure machines are validated, automated blood pressure monitors with multiple cuff sizes, and they are to be used in the clinical setting. Monitors can take 3 blood pressure measurements and then average them with the clinician out of the room. The provider then uses the average blood pressure measurement as the treatment reading. It allows for unattended measurement, which greatly reduces white coat hypertension. And nationally, we've been able to help practices implement the utilization of the AOBP machines into their workflow with minimal disruption. The cons, of course, are that it can be expensive, and again, the perception that it will disrupt workflow, but keep in mind that the American Heart Association is able to work with clinical systems on their workflows. And then finally, we have conventional office blood pressure measurement, which is both convenient and inexpensive. Conventional office blood pressure measurement, however, is greatly impacted by the person taking the blood pressure, the patient, and environmental factors. We find that many offices are not set up for proper positioning, and therefore the measurements are rarely performed correctly. And there's often concern about the time needed to take a proper blood pressure measurement, which is approximately 5 minutes or more. White coat hypertension cannot be ruled out, and patients with masked hypertension cannot be identified. Also, terminal digit preference is more likely if done manually. And terminal digit preference is defined as it's a phenomenon whereby an observer rounds off a measurement to a digit of his or her choosing, commonly the terminal digit 0. So knowing that it is the least effective way to measure blood pressure, why do we continue to use conventional office blood pressure measurement? Well, we do so because it's convenient, cost-effective, and due to time constraints. So what can we do to improve the quality of in-office blood pressure measurements? We can reduce measurement errors, and we're going to be reviewing common errors shortly. We can standardize the process of measuring blood pressure, which reduces variation in the measurement technique, and we can perform multiple measurements and average them. And so another pop quiz question, which method, after reviewing the 4 methods, which one do you think is preferred? So while the automated blood pressure machines are preferable, as they do provide more reproducible results and are not influenced by variations in technique or the bias of the observers, there is no definitive stance on the use of either method. Whether or not clinics are able to invest in automated office blood pressure machines or use simple manual practices, neither is good or bad. Rather, the goal is to implement the M framework that we're reviewing today to ensure that no matter the method you're using, that healthcare workers can ensure accurate measurements. Now Chelsea's going to cover the common errors that we find when blood pressure measurements are taken.
Thank you, Jessica. As you can see here, all the common errors that can have a significant impact on blood pressure measurements. I'll wait for those to catch up to the screen. Some simple solution for these errors could be, for crossed legs, asking the patient to uncross their legs. For blood pressure cuff over the clothing, asking the patient to lift the sleeve, or if that's not possible, putting a patient in a gown, or making sure to ask the patient to come dressed for taking blood pressure to their appointment. For blood pressure cuff that is too small, make sure rooms have multiple cuff sizes, or if the blood pressure cart is used, making sure they have multiple cuffs on that cart. For full bladder, being able to suggest that the patients use the restroom on their way to the exam room. For talking or active listening, asking for silence or stillness, or leaving a patient to sit quietly and calmly in the room for 5 minutes before taking the measurement. For unsupported arm, using a desk that actually meets at heart level, or using the exam table to help keep the arm at heart level. For unsupported legs, using a stool or pulling out the exam table to make sure that legs are supported. And for unsupported back, using a chair with a back or a stool that's close enough to the wall to support the back are some ways to help with those. Normally in a live presentation, we would ask you to identify what is wrong with this picture, but instead I'm going to talk you guys through it. So what's wrong with this picture? Well, first, the patient's talking on the phone, actively talking and listening, presumably. The patient's feet and legs are not supported, and the leg is crossed. The back is also not supported, nor is the arm supported at heart level. As you can see, it's resting on his knee. And finally, the cuff is over his clothing. This picture may be the extreme of what can go wrong during a blood pressure reading, but keep in mind, even one of these mishaps can lead to an inaccurate blood pressure reading. And what issues do you see with the setup of this room for proper positioning? Well, first, the blood pressure monitor is too far away from where the patient is seated. Additionally, the chair doesn't have any arms. So while the back is supported and the feet can be supported, the arm can't be supported at heart level. We've seen clinics use blood pressure monitors that are on rolling stands, and then they have baskets attached to them. Clinics have used these baskets to rest the patient's arm, so always consider that an option if that's what your clinic is able to use. And finally, the exam table is not suitable for use in the blood pressure positioning setup because the back is not supported and potentially the legs and feet may not be supported unless they do pull out the rest for the leg and feet or have a stool that they can pull near the exam table to rest the feet. And finally, using the wrong size cuff is the most common error in blood pressure management. Measurement. Using an upper arm cuff is important. Wrist devices are only used if the patient has a contraindication for performing blood pressure measurements on both upper arms, or if they're unable to fit an upper arm cuff. Finger cuffs are not recommended. We recommend using mid-arm cuffs, centering the cuff bladder over the brachial artery at heart level. A properly fitted cuff should have a bladder length that is 80 to 100% of the circumference of the arm and a bladder width that is at least 40% of the circumference of the arm. And now Jessica is going to review the steps to measuring blood pressure accurately.
Thank you, Chelsea. So the first step in measuring blood pressure accurately is properly preparing the patient. And so you can see this visual here. It's called the red infographic from the American Heart Association, American Medical Association. It's since been updated, and I believe now it's purple. But what you can see here are some tips to get an accurate blood pressure reading and preparing the patient. Using proper techniques for blood pressure measurement, again, as identified in this red infographic, and taking step 3 is to take proper measurements needed for diagnosis and management of high blood pressure. So that is taking multiple measurements, 1 to 2 minutes apart, and then properly documenting those blood pressure readings, averaging the readings, and providing those blood pressure readings to the patient. We wanted to share with you too some recommendations, clinical system recommendations that clinics can implement in order to strengthen their clinical systems to achieve strengthened hypertension control. The first one is displaying that red graphic that we just showed you in every exam room by a blood pressure machine or wherever blood pressure measurements are taken. Ensuring blood pressure measuring accurately trainings are available to staff and required of staff every 6 to 12 months. Adopting standardized blood pressure measurement protocols, which include obtaining confirmatory blood pressure measurements, And then creating that environment that's conducive to proper positioning to allow for a more accurate measurement where arms, feet, and back are supported. And then ensuring all devices are calibrated according to manufacturer recommendations and the 2017 ACC and AHA hypertension guidelines, ensuring the use of only validated devices, and the implementation of self-monitoring blood pressure programs for hypertensive patients. The AHA and AMA have developed a Measuring Accurately Quick Start Guide to aid professionals in a clinical setting in assessing and developing protocols for accurate blood pressure measurement. The Quick Start Guide can be found on the TargetBP website, which is www.targetbp.org. And here we will review the components of that guide. The first component of the guide reviews tools to assess how your healthcare organization currently measures blood pressure. And it is important to understand how you and your healthcare team currently measure blood pressure in order to identify the ways that can be improved. And you can use the following tools to help establish that baseline. So we have a quick blood pressure measurement quiz. We have a Measuring Accurately pre-assessment and a technique quick check tool. And then the next component of the guide focuses on building your healthcare organization's knowledge in accurate blood pressure measurement. So we recommend watching trainings such as this one. We have the Measuring Accurately webinar available on the TargetBP website where you can receive CME or CE credits. We also recommend possibly hosting a journal club discussion on the AHA scientific statement on blood pressure measurement. Or perhaps watch the AHA scientific statement on blood pressure measurement webinar, and again, receive that CME or CE credit. And that webinar, again, is available at the TargetBP website. Third component of the Quick Start Guide focuses on training your care team on evidence-based blood pressure measurement techniques using the following tools in a clinical setting. So we have a blood pressure positioning challenge, steps to accurately measuring blood pressure infographic and document, technique quick check tools, and we do recommend a monthly audit of staff technique, blood pressure measurement infographics, and though that's that red infographic that we shared with you that can be placed in every room. And then again, the trainings such as this one that we have available on the TargetBP website. And to receive the latest blood pressure measurement information from TargetBP, we also encourage you to sign up for the newsletter at the link that you see on the screen.
Thank you, Jessica. And thank you all for attending and watching this, this recorded webinar. Unless otherwise noted, the information from this presentation was obtained from the AHA and AMA webinar titled The Importance of Measuring Blood Pressure Accurately. For additional information, please access the webinar at targetbp.org, as you can see here on the slide. And to download the full version of the 2017 hypertension guideline, please visit professional.heart.org/hypertension. If you have any questions, please do not hesitate to follow up with the American Heart Association at ws-chronicdiseasemanagement@heart.org. On behalf of Jessica and myself, we appreciate your commitment to your patients and your dedication to high-quality blood pressure management. Thank you.